Welcome to step 4, which is exercise. We want you to learn how to move properly so that you don't irritate your back and so that you can build a stronger spine. One of the best ways to do that is through working from the ground up. And these exercises that we want to show you, they're simple, but they're not easy. And we're really focusing in on quality. And kind of like our overall philosophy on movement is you gotta basically crawl before you walk, and then you gotta walk before you can run. Check out these exercises, do them, focus in on quality, and practice them. If you get any pain with these exercises, please stop. It doesn't help to exercise in pain. In fact, pain changes the movement pattern. And as you know, we are constantly after getting the right software in your brain so that you exercise and you move better, because then you'll feel better. The 3-month supine unsupported is designed to prepare your body for your exercises. Listen to your body and see if you have any aches or pains or any tight spots. If you have any tight spots, try to breathe into them and allow your body to relax. Notice how we're trying to stretch and mobilize your limbs while stabilizing your spine. We suggest doing anywhere from 10 to 30 breaths, nice and slow, at a 4-4 tempo. Hook lying is your next exercise. Put your hand so it's a little bit farther up from your ear, so it's not completely horizontal. Slowly let your knees fall out to the side. Do not get any torque in your back, and let it gently stretch through your pecs. Your opposite hand is on your rib cage, and you're working on trying to breathe in to that area and letting any tight areas relax. Prepare your body for exercise. We suggest anywhere from 10 to 30 breaths. Next is the fallout. This exercise is moving at your limb while you're keeping the spine stable. Focus in on movement quality and do not let any motion happen at the pelvis or at the spine. The heel slide also focuses on moving at your limb and not your spine. Do not let your spine lift up or push down into the floor as you're doing this exercise. The spine and the whole body should be quiet. The only thing moving is the hip and the knee. Lastly, keep the 2 pelvic bones level. Don't let them shift. Bird dogs, upper extremity. As you're raising your arm, do not let any movement happen at your spine. Don't let it pop up or extend down. When you're doing this exercise, just move from the limb. Bird dog's lower extremity uses the same principles as the exercise we just finished. Focus on moving the limb and not the spine. You should be able to have a coffee cup on your low back area without spilling. Dead bugs are basically inverted bird dogs. We'll start with the dead bug upper extremity. Keep the spine adhered to the floor and do not let the rib cage pop up or flare out. Dead bugs lower extremity. Do not let your rib cage flare or your lower abs push up as you're going down or going up with the lower extremity. Clams are a great glute exercise. Be aware of the top hip and make sure that the top hip bone is pointing towards the floor, not straight ahead or up towards the ceiling. The spine should not be sagging, the spine should be completely straight, and the low back should not be arched too much. The lowering phase of the clam should be very smooth. It should not look like a sprinkler ratcheting down. Your last exercise is the bent knee side plank. This is a static exercise, and alignment and breathing are very important. Don't allow your body to cave in or melt to the floor. Instead, push your body away from the floor. Stack your pelvis over your rib cage, and your rib cage and the shoulders are stacked over the head, and the head is in neutral. We suggest only doing 2 to 4 breaths on each side. That concludes our exercise routine. The question that you might have is, how many reps, how many sets should you be doing? We like to use what Stu McGill uses as a descending order. What that means is with some of your exercises, the ones that you're actually moving in, we want you to do 5 reps for your first set, then 4 reps for your second set, and then 3 reps for your third set. If you're feeling strong and that's not enough challenge for you, then maybe go ahead and do your first set of 6, and then your next set 5, and then your next set 4, and then you could work yourself all the way up to 10 repetitions. What we like to do is do the side that has more pain or is weaker. Don't add too many repetitions at one time. We don't want you to go backwards and get injured. And if any of these cause pain 24 or 48 hours after, then you probably have done the wrong exercise, or you've maybe done too many reps, and then slowly build yourself up. Good luck with that, and you're on your way to a better back.